Again, this is our Whole Person Care webinar series. I am Dr. Holly Lucille, an naturopathic doctor and senior medical advisor here at FullScript. And it's wonderful to have you here for our second session on our series on inflammation and cardiovascular health. So if you missed that first session, during which we explored various inflammation tests for cardiovascular health way beyond the lipid panel, or you can watch the recording at fullscript.com/webinars in a couple of days. So next slide. Leading this session is Dr. Melissa Carullo. She is a naturopathic doctor as well and senior manager of medical information and safety at Metagenics. Dr. Carullo leads the clinical services support team, ensuring healthcare providers that they have access to accurate evidence-based product information to enhance patient safety and efficacy. Her work is instrumental, in shaping Metagenics' commitment to scientific rigor and clinical applications, supporting both practitioner success and patient wellness through integrative medicine. So before we get started, again, submit your questions in the chat and we'll address as many as possible. This is going to be recorded. And if not, you can it'll be emailed to all of you that are attending. And if you've registered and not able to attend right now, and then also in a couple of days at fulk.com/webinars. And the slides are available also for download in the files section of the platform here. And again, there will be another 5-minute break between each session. So again, thank you so much for being here and joining us. Dr. Carullo, take it away.
Thanks, Dr. Lucille. That was a lovely, that's the first time I've heard that. That was beautiful. Thank you. So before I get started, just a reminder that this presentation is for education purposes only. And perfect, the slides are advancing. So I'm not sure if anyone has actually been successful in educating on specialized pro-resolving mediators in 20 minutes or 25 minutes or so, but today we're definitely going to try. So my goal today is to really just highlight this novel approach to vascular health beyond traditional anti-inflammatory and lipid-lowering strategies. So vascular diseases, these are profoundly affecting blood circulation and are among the leading contributors to global mortality and morbidity. These conditions arise from dysfunctions in arteries, veins, capillaries. They lead to impaired blood flow, oxygen delivery to vital organs. So a whole host of signs and symptoms. And this central, often overlooked of vascular disease is actually chronic unresolved inflammation. This can perpetuate this endothelial dysfunction. It can disrupt vascular integrity and just accelerate the progression of conditions such as atherosclerosis or worse, something like a stroke or heart attack, unfortunately. So current conventional treatment options are going to help alleviate symptoms, but often fail to address the underlying chronic inflammation that's driving this disease progression. So it will leave patients vulnerable to recurrent events and long-term complications. Research suggests that a deficiency in SPMs, or specialized pro-resolving mediators, they play a critical role in this development and recurrence actually of cardiovascular disease. Those with cardiovascular disease, they tend to exhibit this imbalance between the pro-inflammatory and pro-resolving mediators. This can lead to persistent vascular inflammation and dysfunction, and that's going to drive this ongoing disease recurrence. SPMs appear to be that missing link. They offer this potential solution by restoring balance. They have the potential to improve vascular function and reduce inflammation-driven complications. Ultimately, the goal with the SPMs is to support this long-term vascular repair and stability. For those of you that are not familiar with SPMs, this is the first time you've heard or seen of them. They are lipid-derived mediators. They are derived from essential fatty acids. And what they're used for is resolving inflammation via the internal cellular repair mechanisms. They arise from, you can see from the diagram here, arachidonic acid, EPA, and DHA. There's several classes of SPMs. They work synergistically together. Right now, there's 5 known classes documented in the literature or any published literature, and those are circled in yellow on the slide: lipoxins, resolvins, myrisins, and protectins. So the inflammatory process itself, this consists of 2 distinct phases. There's the initiation phase and the resolution phase. And the ability for humans to just mount an inflammatory response in general is very critical to protection and survival of the human being. We have evolved these finely tuned mechanisms. They're geared towards responding and actually protecting us from any harmful stressors. This could be infection or or tissue damage, for example. And these events form what is known as that initiation phase, the inflammation initiation phase. It's that body's response to stressors and all the activities that are associated with what we know from medical school as the cardinal signs of inflammation. The counter regulatory response, that would be the second phase. This is known as the resolution phase. This phase is also very critical. It's going to provide balance to the activities that take place during the initiation phase. The goal of the resolution phase is really just to reduce the magnitude of further pro inflammatory activities. We want to clear affected tissue following initiation phase and support tissue repair, healing, and ultimately just this return to homeostasis or balance. Another way we can think about this or explain it is that resolution really helps our affected tissues respond more appropriately or maybe just bounce back from a response, promote this overall physiological and cellular resilience. Okay, so historically, inflammation was really crucial. It was crucial for us as humans for survival. It helped our ancestors combat infections and heal wounds. And in these times, it was a robust inflammatory response. It was this beneficial trade off since the body is able to respond appropriately, forcefully, and it helped us overcome infection or helped our wound heal a lot quicker. However, as we transition into modern day, the context in which our bodies respond to inflammation in general has dramatically changed. I think we face a lot of new challenges nowadays. This could be chronic stress, a lot of environmental stressors or toxins. And these factors are known to just skew our body's response to inflammation in general. So it turns what we knew as this mechanism at one point, the survival mechanism, into this potential threat because chronic inflammation is inevitably just associated with modern life now. This can lead to increased chronic conditions, especially over time. So, if we compare the normal inflammatory response, and that's what we're seeing on the left hand side of the screen, to when chronic inflammation is present, and that's depicted on the right hand side of the screen, what we see is that instead of this balanced response between initiation and resolution, this pro inflammatory phase is going to continue. And individuals tend to be stuck in this vicious cycle or this vicious initiation cycle. And as you can imagine, this could be problematic with time. So, anti inflammation and pro resolution are not equivalent. What does that mean, or what do we mean by that? So, traditional anti inflammatory therapies, these have the ability to reduce the magnitude of the inflammatory initiation response, but they're not necessarily promote resolution. And this distinction is like basically very important because SPMs do not function like traditional anti-inflammatories. Instead, they're going to act through unique biochemical pathways. And again, the goal really is to restore balance or homeostasis overall. So let me walk you through the biosynthesis of SPMs. So this could be somewhat of a busy diagram. So if we look at initiation, so during initiation, we have pro-inflammatory lipid mediators. This could be something like leukotrienes or prostaglandins. They're going to be predominant. They're shown in red on the screen. And if you follow the green connection downwards, you can see prostaglandins are going to increase 15 lox. This is actually a key enzyme that drives the production of SPMs, and the SPMs are shown in blue. This increases, inflammation resolution is going to take place. You can notice also that the diagram is laid out somewhat a map or a subway map. So if you close any of the stations or down the middle labeled in yellow, the bottleneck effect is going to take place. So we're going to really reduce downstream production of SPMs over. Okay, so this bottleneck effect is what happens when any conventional medications, anti-inflammatories, or in this case, COX inhibitors are being used. So whenever we're using these medications for treatment, we can see that production of prostaglandins are blocked. They're blocked by COX inhibitors. So because the prostaglandins promote downstream into 15 LOX, and then 15 LOX is needed for production of SPMs for downstream, you can see why the COX inhibitors are considered this like resolution toxic substance. They help with pain symptoms by blocking initiation further up in the, but actually prolong that inflammatory cycle. And ultimately, this resolution or the production of SPMs to reach resolution is just not taking place. So, in contrast to anti inflammatories, SPMs are just not immunosuppressed. So, we can see here that there's quite a few preclinical models that have shown that SPMs actually improve infection outcomes without compromising the immune response in general. So this makes FPM like particularly promising for any chronic inflammatory conditions that coexist with infection risk at the same time as well. Okay, so macrophages. So this is an interesting concept, and there's a lot of new research coming out surrounding and their phenotype. So macrophages are going to play a dual role in vascular health. They transition along the spectrum between pro-inflammatory, which is like an M1 state, and a resolving M state. And it's a cycle that mirrors the two-phase inflammatory response as well, the initiation and resolution phase. So during the initiation phase, we're going to see macrophages adopt this M1 phenotype. They're going to drive inflammation to address an infection. And then if this state persists, it's going to contribute to chronic vascular inflammation, endothelial dysfunction, plaque instability, and as these are all hallmarks of conditions such as atherosclerosis. Yeah, there's a lot of information on this slide. I think I can sum it up a little bit. So, when SPMs are present in damaged vascular, in any damaged vascular environment, they're going to actively signal the immune system to just stop this excessive inflammatory response. And we want to begin this tissue repair. We want to shut down any of these killing mechanisms and really move towards this homeostasis. They work by activating specialized receptors on immune cells, and these will guide the body's resolution pathways. So again, this is going to this is going to further prevent damage by stopping excessive neutrophil activity and promote cleanup of dead cells and harmful debris. So we're going to be able to reduce plaque that's built up in the blood cells. At the same time, as encourage these macrophages to shift from this M1 state to an M2 state. It will reprogram these immune cells to resolve inflammation in a controlled way, and then over time, reduce risk of chronic vascular disease. So, this unique ability of the SPMs to resolve rather than just dampen or suppress, it really makes these SPMs more advanced in their approach to manage vascular inflammation because we might actually be able to reverse some of the damage that has happened. And so this slide is a nice diagram, but again, it's busy and it's really illustrating in detail 3 phases following vascular injury. So everything we've gone over so far. So if we look halfway down the screen on the left-hand side, we see injury to endothelial cells and this underlying vascular smooth muscle cell. This is the initiating event. So the expression of cytokines and cell adhesion molecules is going to increase from here. It's going to result in an increase in pro-inflammatory mediators. We see that arachidonic acids being converted into pro-inflammatory lipid mediators, etc. That's all going to promote vascular permeability, platelet aggregation, this process that we know well that happens during injury. So if a lipid mediator switch occurs, synthesis of SPMs is going to begin and inflammatory processes begin to decline. This is going to reduce cytokine production and just produce this promoting tissue repair from M1 to M2 macrophages. If in any instance resolution is delayed or insufficient, these inflammatory signals are going to persist, resulting in dysfunctional vascular smooth muscle. And that's what you're seeing on the right-hand side of the screen is its narrowing of the blood vessel. This is just a summary similar to what the past couple slides went over. It's going to detail mechanisms. Because we only have about 20-25 minutes for the presentation, at least you have all the references here to look back at the mechanisms because it can be quite confusing, especially since everything is on a spectrum relating to SPMs. So this is actually a really nice study. This was done at human clinical trial. It was published in the American Heart Association Journal, so very prestigious journal. They explored the effects of SPMs in 10 peripheral artery disease patients and 10 controls. This was over a 5-day period. And the patients were receiving these escalating doses of SPM supplement. So 1.5 grams, 3 grams, 6 grams, and there's a washout period in between each of the doses. The study investigation was looking at post-supplementation, how can we affect the circulating levels of SPMs, and then immune cell responses to inflammation in general. So the bar graph on the left of the screen, this is going to represent the difference in circulating lipid mediator levels from baseline and at the end of the study. In dark blue, a significant increase in plasma levels compared to baseline of the SPMs. And then on the right-hand side of the screen, the bar graph is telling us that supplementation also enhanced monocyte in the study, neutrophil phagocytosis also increased. In other words, what they found was the cells were actively engulfing and removing pathogens. So that ability for the cells to clean up the cellular debris and move the body into resolution or homeostasis was actively occurring. It was also noted that immune cells showed reduced levels of pro inflammatory markers, suggesting this shift to a balanced, less inflammatory state, or an M2 state, if you will. So, great outcomes overall. There's better immune function and less adhesion molecules found on the surface of the macrophages. So, this study explores potential benefits of SPMs in improving the success of saphenous vein grafts. This is definitely important since they're commonly used in bypass surgery. And one of the main challenges with the grafts is that they're prone to inflammation and vasospasm. So, this could ultimately lead to graft failure in patients. So researchers pre-treat human saphenous vein samples with SPM, and they found that these mediators actually reduce the release of pro-inflammatory molecules, decrease vascular contractions when under inflammatory conditions. So clinically, the ability to resolve inflammation and improve vascular function without compromising the immune defenses is a great promising outcome because essentially that's what we need for any type of tissue graft or organ transplant, right? We want to minimize complications and enhance outcomes for success. So this slide serves also as a reference. It's a summary from a recent review paper which I think was published just at the end of 2024 in, can't remember the journal, but it was all about cardiovascular disease. So it highlights the impact of SPM on resolving chronic inflammation, stabilizing plaque, and improving vascular health. For example, we can note from the slide that in myocardial infarction and heart failure, SPMs help limit inflammation and adverse remodeling. In thrombosis, SPMs can reduce clot formation without impairing hemostasis. So the info is really nice. It's great insight as well into this growing body of research supports SPM use for cardiometabolic health protocols. So I've been using SPMs in practice for, I think, well over 5 years now. Time flies, so I can't really quite remember, but it's been quite some time. And I have nothing but great reviews and honestly just jaw-dropping stories. But if we're keeping it, focused on vascular function today, I've used this in a lot of patients post-stroke, transient ischemic attacks. I use it a lot for improving vascular function and tone in the blood vessels for my patients, especially in those that are receiving IV therapy, because it's a lot easier for me to work with veins that are flexible, right? And easier to work with. I just wanted to go over a case before we go to Q&A, but this is a 34-year-old male. So he is the son of an already existing patient of mine with a recent history of deep vein thrombosis. He was playing hockey, just like a recreational hockey game, when he experienced chest pain and shortness of breath. So he took it easy. He went to the bench, and it was not until he was in the locker room when he noticed the swelling in his left leg after showering, getting dressed, ready to leave. He decided to head to the ER after a brief phone call with his mother, diagnosed with DVT, given anticoagulants, and admitted for observation. So I saw him a few months later because he was concerned about the number of flagged biomarkers on his lab report. And so in taking his history, I learned he was under extreme pressure at work. He co-owns a very large electrical company with a very large staff that he manages. Typically he'll leave for work between 4:30 and 5 in the morning. He's trying to tackle as much paperwork as he can before he's on the road. And he usually doesn't make it home before 8 p.m. at night. So meals or whatever can be picked up on the go. And when he is at home, him and his wife, he has two children, they tend to order takeout. So she's not really keen on cooking, and it's just easier for them to order takeout. So alcohol consumption daily in the summer months, him and his family, they head to an RV park on weekends with friends. So alcohol consumption is much higher during that period of time. But it's not surprising that the were elevated. He does have a factor V latent heterozygous variant, so that's going to increase his risk of abnormal blood clots as well, and also his risk to develop vascular conditions. So for him, I really just went back to basics. There was a lot of education around why diet and lifestyle changes were going to be very important, given the thrombosis diagnosis. Because he was always on the go, a medical food was suggested 1 to 2 times per day, and that was ideal for him since they're just easy to pack and all you need is water to mix them up. You can see that other than that nattokinase and SPMs, my approach was really just to clean up the diet and replenish with foundational health formulas. I use a multivitamin that has amazing research supporting it use for upregulating cell signaling and decreasing a lot of cardiovascular disease risks just in itself. So he made a considerable change, like the diet changes was huge. He reduced alcohol quite a bit. He lost 35 pounds, I think, within the 4-month span. And so he was feeling quite good about himself. So when I followed up again at 6 months, he was not taking supplements on a regular basis. As we talked through things, like together, we decided he would continue with the medical food because that just helped him out on a day-to-day basis with his life and the nattokinase and SPMs. And you can see from one of his comments on the slide that basically any big shifts in his lifestyle factors, for instance, say they were down south for vacation for a week, he would notice swelling because he moved off of the health path for a little bit. So he swears by his SPMs and his natto. And anytime the dose kind of decreases, he notices his leg swellings. Yeah. So in summary, SPMs, they're really just going to have this active role in resolving inflammation. They can reduce pain. They can limit neutrophil-driven tissue damage, enhance macrophage clearance. They also modulate key inflammatory pathways. Ultimately, they're going to prevent chronic inflammation. And clinically, SPMs really offer this targeted approach to inflammation resolution, something that we can't really get from other natural anti-inflammatories, right? Because these are not immunosuppressive therapies, especially when we use them in vascular pathologies. We might even see a reversal of symptomology present. And so I think that's it. How did I do on time?
Okay, I'm back. All right. Excellent. Okay. Yeah, just a couple of questions here. And then there was a lot of activity. We're not going to have time to get through everything. Let me ask you this. Can SPMs levels, can they be tested?
Yeah, so right now they can be tested. So serum levels can be tested, but it is for research purposes only. So that's a drag, but we can test omega-3s, right? And so worst case scenario, you can extrapolate that information. If you're doing an omega quant and individuals are sufficient or omega-3, omega quant testing, it might be an indication that if there are signs and symptoms that chronic inflammation is present, that SPMs might be needed just to get that person over the hump or reduce the overall load. And then, yeah.
Okay. How so? I think that answers one of the questions about is recommending the EPA and DHA. Is it sufficient? And obviously, you're saying it's not. Taking
Yeah.
SPM, take it away.
Yes. It's similar to why we take EPA and DHA to bypass that delta 60 saturase, right? We want to try and just get that active in us that is ready to go. So we probably could use EPA and DHA to produce some SPMs. I think the reality is most individuals always have some inflammation that is not resolved. And so it's very hard to kick them into that process of resolution. I don't think we know exactly, but the research is like showing us, and clinically, we see that when we add SPMs, we're just getting better outcomes. We're getting resolution a lot quicker than without them.
All right. Last one that we have time for, dosing and length of treatment time.
Yes. So I think that I probably dose a little bit different than a lot of others. So there's a lot of protocols out there. I think that they're all quite successful. A lot of individuals, practitioners are going to dose heavy at the start of the protocol and then wean down. I tend to just go in with a medium dose. So let's say 4 capsules, 6 capsules, and try and just stick there basically. So I think that it's going to be different for everyone on the amount of time that they need, because it's going to be dependent on how many areas need support to resolve inflammation. So we might be taking it because we have joint pain and not notice improvement right away, but perhaps there's some underlying gut or leaky gut present that we could be using the resolution for. So like the time's going to vary. If we're looking at pain, most of our studies are showing that within a couple of weeks, we're seeing a reduction, and that's at very low dose. So
Okay.
that's at 1 gram.
Excellent. Great. Thank you. There's a lot of engagement. This is all we have time for. So thank you, Dr. Krulo, so much. Thank you all. Yes, of course. And just if you didn't get an answer to your question answered, or if you have a product specific question, feel free to contact Dr.
For sure.
directly. Okay. Excellent. And just again, we're going to take a 5-minute break and then we'll come back and invite you to join me for Streamlining Whole Person Care, clinical tools for vascular health and inflammation. All right. We'll see you in just a bit. Thanks so much.